Thanks, dude, for having me. Thank you, guys, for your interest. It feels like I already gave a little bit of a speech here before. So just go a little bit into what we're talking about. Obviously, the health starts in your mouth concept. And I'm trained as a dentist in university in Tübingen. I studied from 2003 to 2008. I'm also a naturopathic doctor. And basically, it all started for me like intrinsically motivated to get my body as healthy as possible already 20 years ago when I was always athletic. I wanted to become a professional skateboarder, but chronic illness or a little bit of sickness always kind of like got into my way. I took a lot of antibiotics as a kid. I had recurrent throat infections. When I was 15 years old, they took out my appendix. And when I was 16, they wanted to rip out my tonsils. And at this point, my dad is a dentist, I'm working with him, and my mom is a nurse, so pretty school medical oriented. They told me, maybe you want to see another specialist. We are going to this naturopathic doctor, and I thought it's just kind of some kind of woo-woo thing. Just went there anyways, and he just tested me with autonomic response testing, and he said, you're just allergic to milk, just skip this, and take some chlorella. That's basically it, what I remember. And I did that, and my tonsils are still in there. So this was the first contact I got into that there's something alternative. But it took me quite a few years to figure out that health will be my perspective. So it started out more with health optimization in terms of building muscle, being strong, being better in performing. So I started learning everything about food, nutrition, diet when I was at civil service at the Red Cross. And I didn't know that I'm going to be a dentist because I still wanted to be a professional skater. So for me, everything work-related was like, my dad is a dentist, so that sucks. He's always at work. I cannot do this. So I don't know why it happened, but the Red Cross, you have to do a little bit of a shadowing in clinics. So they put me in dental hospital. And I was just sitting there with all these students. And the doctor, the dentist, he probably just thought that I'm a student. And he just let me rip out all these teeth. And I was just a civil servant, so I didn't know. I just, okay, I do the teeth. Later on, I discovered that all these students waited to pull teeth, and I just did it. And I liked it. So I applied for university, didn't even know that it's going to involve sciences, because school wasn't my thing. I'm more like a hunter type of guy, so I have to do things and can't sit around and listen. So I was skipping chemistry, physics, and I didn't know that I had to learn this in university. I only knew, okay, it's something to do with my hands, and I'm very good and skilled with Lego and tiny things. So I just went into university, don't even think about it. And yeah, from there on, I just did the university. I was good at the craftsman part, became a dentist. But besides that, I was always interested in improving my health, with diet, nutrition. And then I had to learn chemistry, biochemistry, and basically that's when it clicked for me personally. I didn't know that it will apply it later. Still in the last semester of dental school, I was still thinking, and saying to my dad, something is missing here. I don't know what it is. I'm good with my hands, but I don't know why. And he's like, dude, just finish school, because he probably was afraid that I will skip it at the end. And it's just the entrance card. And it was perfectly sad of him, because I just viewed it as an entrance card, and after university I wanted to become a surgeon right away, just do surgeries, doing implants, removing teeth, because that's the way it started. And yeah, basically this involved my whole journey, because my first doctor, you have to do a tendency for 2 years after university before you're allowed to do your own clinic. And I was lucky to find Dr. Wolf, who is like a specialist in titanium implants, and I could learn from him, but he was still doing amalgam fillings. And being aesthetically driven also, I was like, just saying him on our first meeting, I can't do amalgam fillings. I think they're ugly. And I heard from my dad that he's not doing amalgam fillings for 20 years already. But I didn't learn it in university. In university, I just learned amalgam, perfect stuff, will last forever, super cheap. You cannot apply it to children and to pregnant women. That's it. Besides that, it's healthy. So because I told my doctor boss then I won't do amalgam fillings, I had to look a little bit into this, because I just said it like, I don't do it, like shoot first, ask later style. And then I looked after it in YouTube and Instagram, not Instagram, YouTube. It's like 12 years ago, YouTube, and found Dr. Dietrich Klinghardt as one of my first mentors, and the whole field of this functional medicine, heavy metal testing, heavy metals, all these things open for me, and it was actually the same thing I was doing for my body in terms of biochemistry. So I had the basic knowledge already to see, okay, this is how liver phase 1 and 2 works. Okay, I need these and these supplements. So it just clicked, and all the dietary stuff I was already implementing in the first year, and I thought, okay, amalgam fillings, that's the holy grail. Remove the heavy metals and all my patients will be healthy. Wasn't a deal at all. So a few of them got healthier, a few of them got really sick, even if I was applying already all safe removals and stuff. So I had to search and search and search. So I was searching and learning. I was a functional medicine doctor now, and I even did a naturopathic doctor in Germany, which is called Heilpraktiker. And yeah, and basically was searching for something that I could do, like biocompatible as a surgeon. Yeah, because a titanium implant, I knew already it's metal. I cannot do metals in your mouth in terms of health optimization. So my focus shifted actually along the whole studying from just the reparation, which you're doing as a dentist. You're basically trained to be a perfect craftsman, but you just go in to see the dentist to repair things that are broken down. More of like a garage where you bring your car and then you just go there and fix it. Maybe you have a cavity, maybe you need a root canal. But the only focus for the dentist is, can you bite on these teeth or not? So if you go back to this one, you only focus on what you see here. You don't focus on this. And if you look at this is your brain. And this is a nerve. It's called a trigeminal nerve. And there's 12 brain nerves, which start here in the brainstem. And 50% of the space of all these 12 brain nerves is reserved for this trigeminal nerve. So this is kind of important, I guess. And all these teeth are tiny little organs pretty close to your brain. They're actually like a part of your brain further out, like your eyes. So they have nerve supply, lymph supply, an autonomic nervous system. It's all in the tooth. But this is not the focus. Focus is just repairing. And this is because the dentist initially comes from being a craftsman and not a doctor. And this was the part that was missing for me. I was just searching for being a doctor, helping people to getting healthy, like I did with my body. This is more like a calling. And nowadays it's a full system where we use everything we find in terms of biohacking, functional medicine, health optimization. It's kind of overlapping, and of course you have to have the high dental skills, yeah. But this is just the technicians, and this is how it's got into a concept which took me like a few years to figure it out. But now we're training dentists all over the world, so we already have examined 30, which is nothing but 30 specialists for ceramic implants and biological dentistry. And they basically have to live this concept. I do the examination, so at the end, I would feel comfortable to send patients there or get surgery myself there. That's basically the goal here. But it's still just in the beginning, and we need. So for me, it is more like a calling, a mission to spread all this information that everything starts in your mouth. Basically, what you have to take out of the mouth, which was installed in terms of reparation, and what you take into your mouth, like food. So food and nutrition is where it all started, so it's a big part of this. We will go into details. I've written a book, and it's coming out in English actually. I'm kind of proud of this because it's only 1% of all German books will ever be translated to US or English, and it's also coming out in French, Canada, and China, which never happens, and it's coming out in March, so in a month. Then I have this supplement company, which is just basically my passion to this biochemistry studies I did back then on me and my colleagues. A health food concept store, and so far, because I'm doing so many surgeries, I've placed over 3,000 ceramic implants. This is a good thing for my dental colleagues here because they're always asking, do they break? They don't. Yeah, you just have to know how they work. The focus is not on a ceramic implant. It's not on the crown. It's more like we need nice materials to restore stuff biocompatible, but the goal is how to get you as healthy as possible and then use these things. And also use, of course, all the techniques, lifestyle, nutrition, supplements, recovery, whatever you name it. And yeah, this is what I'm searching for 20 years. That's why they call me now also a biohacker, which I didn't know, but now I know. And I'm also president of the ISMI, which is a society for metal-free implantology at the moment. So this changes yearly. So what we do is basically checking what is oral interference. So what could disrupt your whole autonomic nervous system or your immune system or make you more toxic? What is installed there just in terms of reparation and biting? We check for metals, cavitations, endo is root canals basically. In the office, we check how to remove metals safely. There are different surgical protocols that you have to learn as a dentist. Use ceramic implants because this is just basically biocompatible. You will learn why it's important. And of course, we focus on how is your body able to regenerate, to boost your immune system. They get you basically out of chronic sympathetic nervous system mode, out of fight and flight into rest and digest, yin, healthy, healing and stuff. Because according to my peers, like Dr. Dietrich Klinghardt, Joachim Mutter, maybe you know these guys, they're very, very famous integrative medicine doctors, or even Dr. Mercola, they talk about these things a lot. 70% of all chronic disease starts in your mouth, yeah? Because you have these toxins 24/7. So our goal, optimal health, performance for body, mind, and spirit. And this is some kind of foundational work. You cannot biohack the way around the dentist. Problem is, the dentist doesn't learn all this. So we have to teach and train, and it's really important. So 5 years ago, I would be attacked by all of my colleagues. It's mostly the biggest problem is your colleagues. Now it shifted. All my friends from university, which back then told me, okay, go away with your stuff, you're the freak, and the nerd, and you're kind of like an enthusiast or something. Now they're all there because they see it's a nice work you have to do, but this is just the science of achieving. It's just a skill. But if you tell me, okay, I was depressed, I had joint problems, my skin problems, or like me, like all these chronic issues in my body, and on the next day you come in and 80% is all gone, and this is the fulfilling part then. Then it's not a work anymore, and I designed the whole clinic like this. It's kind of a setup where you heal in terms of the environment. My whole staff they really love what they're doing. You come in, I'm always like this, I'm not stressed. I talk to you like I would talk right now. So I'm not the doctor talking down to you or belittle you. I'm just wanting to help you get as healthy as possible. And also it's a moral obligation from me to give you all the knowledge I have, but also at the end, you're there on your health journey, and you're also there to help grow this thing and tell other patients, because they're all searching. Chronic disease is the main problem. Because of this elimination of chronic stress, ongoing inflammation, silent inflammation, and it all starts in your mouth. You will now later hopefully know why. So chronic disease is on the rise. This is our epidemic of the 21st century. I was chronically sick when I was a kid. I didn't know. It's just normal to take an antibiotic when I was unhealthy, just to see a professional. I was having acne when I was 16 years old, massive acne. They just gave me raw Accutane and some antibiotics, and I had liver problems every day, or like pain here, but it was just normal. It's fine. But it didn't feel good, and I wanted to be a skater. So my lifestyle in the 90s was more like, okay, who can party the most, drink the most, even be able to do tricks over the pyramid with cigarettes in your mouth? That's fine. I did all this, probably lasts for a whole lifetime. So I know how the extremes work. And I also know how you can come up from there to up here, so I had to figure this out. And this is basically just a solution I found on the way, and it's a lot because it's 20 years, and I'm actually kind of an extremist in the stuff I'm doing. I'm always experimenting, trying new things, figure out the next detail, and just see my problems basically as a challenge and search for this. So that's what we have to do in the future. If you go to a doctor who's looking through the lens of sickness or disease, you will find disease. This is like what in the Bible is saying, like if you search for something, you find it, yeah? So if you search for health, you will find health. Just have to like maybe go to the history. So we have the genetic and epigenetic discussion. You know all about this, and you're probably having a good epigenetic lifestyle already. So epigenetic is basically what is the whole environment doing with your own genetics. And we managed to change our human environment within the last 100 years to an inhuman one. That's basically it. And all these theories and techniques is basically bring everything back to nature. That's basically what we have to do right now, because there's a cell phone tower, 5G up over there. And Tim told me, if you open the window and you measure it, you go berserk, but the windows are shielded, so it's good. Then, of course, we have toxins. So Dr. Klinghardt told me lately, when you do apheresis, like 10 years ago when I started all this, you found 20 toxins after. Apheresis is basically like a dialysis of your blood. And nowadays they find 500. So this is so much increased. It's Dr. Kam Dr. Schraube in Kam. So all these things, plastic, heavy metals, you don't even know what toxins you have to deal with. So basically, detoxing and all these things is more like a survival mechanism, is what he would say. And having stuff installed in your mouth 24/7, how would you detox yourself? You hear in all podcasts people talking about heavy metal detoxification. I never hear them say remove the metal first, because this would be like showering and trying to dry yourself at the same time. This is what Dr. Hal Huggins said 30 years ago. You have to remove the source, and if you remove the source, your body heals itself. Even better if you use all the other tools available. So 24/7 is the problem. Health starts in your mouth. So here's the Lancet showing you that chronic disease is on the rise. This is a New England Journal of Medicine, actually. This is high peer reviewed. So if it's in there, yeah, all these autoimmune processes or problems are on the rise because of your immune system being just overly reactive. And this is what I let you patients send in. It's just a panoramic x-ray of a normal standard patient who has seen a few dentists over the last 30 years just for reparation. So you will send this in, the filled out medical questionnaire, and we will sit down and make a full planning, which looks like the next slide. I will just draw in there, and you get an email with all videos and me explaining it and what we have to do to optimize your health in your system. So you see root canals here, you see metals, you see already some ceramic implants, so that's not titanium. And then I just plan in. This is a preliminary treatment plan, and you can read whatever it's going to be, and then we plan accordingly, because this is the challenge. How can we bring solutions to this challenge that are minimal invasive, that help your body to get from stress into parasympathetic mode? It's depending, of course, on the clinic, on the setup, on the whole team. I'm not having any stress. But for me, that's second nature. You can wake me up wherever you want, all over the world. I will do with every nurse, every surgery, but I need my magnifying glasses. That's the only thing. Could be naked, whatever, but I need these, otherwise I don't see. So we call it all-in-one concept. And this is like we prepare the patient with the right food design, with whatever we need. Then you wait a little bit until you boost it with micronutrients and everything. And then we have kind of like a whole health optimization week where we will do all this. First thing, do you have metals in your mouth? This looks ugly, right? This is not aesthetic. But besides not being aesthetic, it's super toxic. In these silver fillings, there's 50% Hg mercury. We know that mercury is the most toxic non-radioactive element on Earth. And as a dentist, I have to remove it. After removing it from the mouth, I have to remove it as toxic waste product. That got me thinking after university, that doesn't make any sense. I cannot place something super toxic in the mouth of a patient just because it's subsidized from the government or something. Makes no sense, and also it's ugly, right? Then we have the toxicology, so it's just toxic. There's also other heavy metals involved. Then we have the immunology. There is always an immune reaction involved if there's something that if you get allergic to this. So it can be just your toxic burden will be increased because you have to get rid of these. So if your body is able to detox pretty well, you probably can manage this for a few years. But of course, it will cost you micronutrients, nutrients, just to compensate for this. Why would you want to have this in your mouth if it comes to optimal health? You could be allergic to this, yeah, not just amalgam, basically all metals. Just ask Linda over here with the ELISA test. You could test this up front. Is there any allergy? She's way better with the allergies than me, but you can test for LTT and lymphocyte transformation tests. You could be allergic to gold. You basically could be allergic to all metals because they're not supposed to be in your body. Good marketing if you want to be Terminator maybe, but not for optimal health. Then you have the batteries. So there's a galvanic because you have the saliva, which is an electrolyte. And just basic physics show you that the electrons travel from the cathode to the anode if you have an electrolyte. That's what happens here. If you have, for example, if this is an amalgam filling and the next one would be a gold crown, there's a current in between. Or you have a titanium implant and a gold abutment on top. What you will have is a current there. You can measure this. Sometimes it's 3.5 volts. That means you could run a full battery on this. And of course, your whole system is also a microcurrent. You will interfere here. And this one is a biggie, EMF right now. Every metal, even tiniest particles, are being antennas in your mouth. There's the cell phone tower. And studies are pretty clear that if you normally do a phone call, the electromagnetic waves go from the cell phone tower to the phone and back. But if you have any metal, also if you have a metal hip or something, it will go there, amplify to 400 to 700 fold, and then disrupt the whole system, make you more electrosensitive. There are lots of patients getting electrosensitive nowadays because of these things. Think about microantenna. Yeah, and also the corrosion. This is just basic. You know, everybody knows that. I don't know the word in English. This is from a boat. What is that? Propeller. The propeller. Yeah, it will rust or corrode. And this is stuff we regularly harvest if you do an all-in-one concept from your system, from your mouth. Does that look healthy? Of course, it works for biting. That's the function, like the biting point of view. But optimal health, looks different. So here you have the battery effect. So it corrodes. The saliva is the perfect electrolyte, and you have a current that could disrupt your system. Also with titanium implants, we will find rust. It's also pretty clear in research that just if you implant it, oxide particles will spread into the system, and there will be an immune system. So macrophages are just there to what is it in English? Phagocytosis, probably. Phagocytose it. Just eat it basically, and then make an innate immune response. It's always TNF alpha, interleukin 1 beta, NF kappa B, so the chronic silent inflammation. It's there ongoing, and that's basically how a titanium implant osseointegrates itself, whereas the ceramic implant, which is the solution, only osseointegrates if your body is able to build bone. And this is where it's coming back to your lifestyle. Is your diet in check? What about your protein? Are you a vegan? Do you don't know how to be a vegan correctly? Which kind of mindset are you following? It's just basic rules that apply within every mindset. And I'm lucky that I've tried all these mindsets for the last 20 years and can just basically, after surgery, give you an individualized lifestyle design it within 5 minutes. I just said, okay, your problem is more like metabolically. Okay, you have to detox better. You have to go a little bit on a ketogenic phase to like 3 months. You might need a little bit of a carbohydrate source in the evening because you cannot sleep and being a little bit depressed. So just, I see macronutrients more like, kind of like medication, and time them accordingly. That's why I call it macronutrient timing and micronutrient tuning. But we need just things that make it biocompatible. And when I had this, and Ulrich Volz, my second mentor, he invented this. And we together, we have the whole curriculum. And I saw him doing surgery. He's a great surgeon. You see it within 1 minute. And then I saw him placing white implants. And from this point on, the full concept was there. It was 7 years ago. So then it took a few more years. But now it's really, I think that our curriculum is the biggest right now in terms of dentistry when you compare it to regular dental things. He's a dentist colleague over here. And it's just boring to go in normal dentistry because it's just techniques. You can just show me like in a minute and just copy it. But new things like how to help your patients getting healthy. This is what a doctor should do, right? And this is the passion. Nice study when you do a phone call and you have a mercury filling, silver filling. The vapor which comes out anyways every day will be increased, Study is from 2008, just PubMed it. It's just all there. And this is the EMF, the limit which they had in, so the limit was in 2008, and now it's exponentially. I don't know where this one is now, but probably here. And of course, this is disrupting your whole system because it's not natural anymore. So we see patients heal so much better if we bring them in an area that's shielded, or I don't know the English word, where there's no radiation or no cell phones at all. How do you call it? Huh? No, but there are places in the world where there is no reception or something. I don't know how you call it.
Black spot? Black spot?
Yeah, in Germany you call it Funkloch. Black spot makes sense, yeah. In black spots, they just heal super fast because you go out of sympathetic nervous system within seconds. It's super important that you control these things. So I have an iPhone. I'm not being dogmatic and paranoid about it, but I know how to use it. So it's mostly in airplane mode. Of course, I have to do a little bit of things. I have limits in there. I don't do my Instagram mostly personally. If I do some stories here, I do, but everything else, another one is doing this. We don't have any Wi-Fi at home. Yeah, why? Yeah, I'm just delivering the content and say how it should look like, but I don't want to do too much. And the clinic is all analog. Can I say that? So no Wi-Fi at all. It's all in airplane mode. So all nurses have to have their phone, and all my patients in airplane mode. We have a building biologist walk through this like years ago and measure everything. We don't have these nasty lights. We still use LED, but they are at least having the full spectrum. Tim showed me a few things to optimize in terms of we will add on the earthing for patients and a few more tricks. We're doing a lot of IVs for years. Whatever is possible to help you regenerate and having no big problems. I don't want to have patients sitting there after surgery like they look after a fight with Rocky Balboa. I want to have it like kind of like nicely and being healthy just to heal themselves. So mercury release, it's a good one, right? If you want to find the secrets of the universe, think in terms of energy, frequency, vibration. And these guys, 100 years ago, they all knew this. So Thomas Edison invented the light bulb, actually. He said, huh?
Nikola Tesla.
No, this is Tesla. But Thomas Edison said, Thomas Edison said the doctor of the future will not interest his patients in medication, but in diet and prevention, or nutrition prevention. That's what we basically do right now. So maybe a little bit of their frequencies left over to here. So this is how we remove amalgam. So this is how it looks like. So we have detox protocol, which is just nutrients, micronutrients. We use rubber dam cleanup. This is a suction called IQ air, which is supposed to suck up 99.9% of the vapor. It's not just for your patients, also for us as dentists. We're using these FFP3 masks from industry just to reduce the uptake of the vapor. The vapor is the problem. Yeah, we drill it slow, even break it out. We put chlorella or something else that's binding toxins afterwards in the teeth, and then maybe just do temporary fillings if it comes to this, and use a lot of IVs. The second one is a root canal problem. You can see this left side tooth that looks not so nice, the nasty one. That's a dead organ. That's the root canal tooth. And because you're able to put a crown on top and you don't see it initially, it's fine because you can still bite on it. But in terms of health, everybody would say not so healthy, right? Because it's kind of like a cadaver. It should be underneath the earth. Because normally there's a blood supply. You have seen the first slide with the blood supply, the nerve and everything. If you take out the pulp, this tooth is dead. There's no more immune system. Means if you check the microstructure, you have these dental tubules, which is about a kilometer of length within one root. So it becomes a perfect cave for all the bacteria that anyways live in your mouth. So you have the biggest microbiome is in your mouth. It's very diversified. And of course you have anaerobics living there. If they get a spot where they can hide and compartmentalize, it's a big problem. So this becomes kind of their caves. And if you have a good immune system, you will at least have a cyst underneath or protection. But lots of people don't have any immune system anymore. They just grow into their bones. So one thing is building a tissue or cyst. And the other part the body can do is just build a wall on top. So they kind of grow into your bone. Bone gets more dense. It's called ankylosis. And again, you have the cytokines from the macrophages, kind of like the bacteria lurking in these caves, and the cat, yeah, like a mouse and the cat around, like the immune system cannot go in there, but still produces his inflammatory cytokines. You just have to know TNF-alpha, interleukin-9 beta, NF-kappa B, chronic silent inflammation. That's important. And the bacteria living in there, they produce their metabolites, which is basically, in English you call it volatile sulfur compounds, like thioether, mercaptanes. They increase your toxic burden. And also, again, a problem, you could be allergic. It's always toxic burden, and then your immune system. Toxicity is dose dependent, so it's depending how much you can tolerate. If you're allergic to it, not dose dependent anymore. You know, from people that are having celiac disease, they should avoid even the tiniest particles of gluten, because otherwise the immune system will go berserk. Same here. You can detox a little bit of nickel every day, or mercury, but if you're allergic to this, you will have an immune response all the time, making you like super sick, basically. If you get the flu in the wintertime, you feel just not good. So it's a lot of things from a functional medicine point of view. The other point of view is just a pain treatment, which helps. If you have massive pain, you have to do root canal, but then take your time and figure out, okay, if optimal health is my goal, you can see differently. Don't panic. Yeah, you're probably all fine, but if you see anything declining or you want to make sure there's preventive work or you want to optimize it, just check it. If there's root canals, it could be a problem. Yeah, it's kind of like a bomb that could come any day, having a big infection. An acute thing is always good, actually. Acute means you have pus coming out, it hurts like hell, and you have to do some action. But the thing with the chronic problem is it's mostly a little bit under the radar, and you have it every day, and it costs you about 30% at least of your whole energy, sometimes even 100, and you're just like chronically sick. I always think about dead tissue or about a diabetic foot. No medical department besides the dentist will leave something dead in your body. It's just basics. And the third challenge, which you don't learn in university because it's not medically accepted yet, it's these things called cavitations in layman terms. You can find it in PubMed under CIBD, chronic ischemic bone disease, or FDOJ would be the better word, which is fatty degenerative osteonecrotic jawbone. Or NICO is also a nice name. We always call it NICO because it's kind of a name, which stands for neuralgia-inducing cavitational osteonecrosis, implies that it is a neuralgia involved, basically from the trigeminus. And this dude here, with this nasty spot in his jawbone, so this is wisdom tooth area. You can see the trigeminal nerve here. You can see healthy bone looks a little bit different. He sponsored his head after having the most massive pain and migraines in his brain to commit suicide. And cavitation, like this NICO, is just a pathological term you find afterwards. So we will just be able to do a 3D cone beam and just see that there's differences in the bone structure, and then go from there. And if chronic patients come in, it's always kind of included because this costs energy. And it's, again, a huge cavity for all these anaerobic bacteria, viruses, fungi, heavy metals. They find everything. Dr. Johann Lechner from Munich, Germany, devoted his whole life, 40 years of research to this. He has already 10 peer-reviewed papers out, and one is here. In here, there is, besides this normal cytokines, you find RANTES or CCL5. Yeah? And here's a study that shows that it's also connected to breast cancer and because of this ongoing immune attack. So it's really important. And nobody knows it. And the trigeminal nerve can transport all toxins, bacteria, viruses, whatever you find in your mouth, within 24 hours into your brainstem through retrograde axonal transport. So main symptom, if you have perfect teeth, but you remember that at some point you had wisdom teeth removed and you're chronically tired, or you have like gut issues, maybe you have cavitations. And it's pretty obvious if you had the surgery done, pretty traumatic when you were...
I want to jump in here quickly because I always talk about gut optimization and the amount of money I spent on probiotics and all the antibiotics and stuff, and I've been trying to fix my gut for years. And then when I was in surgery having one of my cavitations taken out, I was holding my small intestine and I was having twitching there and in my kidney. And I had the surgery. The next day I woke up and my digestion was perfect, absolutely, like, and it has been ever since. So like, for me, that's proof that I go, this shit is real and amazing. So that was the one thing that nailed it. So just to let you know, I mean, I've experienced this exactly.
So this one I also discovered actually by chance on my own body. So it was, I would say 7 years ago. I'm always having a lot of energy, of course, but it felt like I would get Parkinson's or something. I had like this very bad skin, like really rashes and stuff, not acne, but rashes, and was tense a little bit and grinding at night. And we were doing surgeries every day, all day long. And some guy to shadow came in, a naturopathic doctor, and he tested me. He said like, that, because I was super tense, and he was like, okay, let's test. And okay, he found an interference. And I was like, what do you mean? Like, let's do a cone beam. So we did a cone beam on my body. And even if I was doing these cavitation surgeries, they weren't so high ranked in my radar because I didn't do it on my body. So we found huge cavitations from me. And I remembered, fuck, I had my wisdom teeth removed when I was 14, 15. And of course I smoked then. I didn't have a good diet and I didn't even care at all. I had like this massive cheeks and just went in. I just remember went in, it was like the hell. And I also remember that after surgery, my mom gave me a Big Mac to eat and I couldn't open my mouth. So that's the only thing I remember. So it kind of was brutal. And yeah, we saw that. And of course, I wanted to have this done as fast as possible and see what will happen. And back then, we just started on one side. And doing the first side, I didn't even prepare. Of course, my lifestyle was okay already. And while doing surgery, I felt amazing in my whole system. And I had to laugh, actually. I told my surgeon, oh, my chronic back pain is gone. Is that possible? And then I was waiting for the next surgery because my skin was still not so good. We did the next surgery, and 2 weeks later I could be a model for this company out there for my skin. So, and from there on I had, again, the moral obligation, and I've seen all these patients so far. So I did over 3,000 cavitation surgeries. So it's a big one, and nobody talks about it. It's not known. Even if there's studies, it will take a little bit of time, but I'm there to inform you. That's the tooth organ meridian system. You can download this on our website, but basically all teeth are connected through the autonomic nervous system with your whole body. That's basically it. And this area is small intestine and heart meridian. Small intestine is your biggest detoxification organ. Yeah. Most people in here have any sort of digestive issue. Could be the stress from there. Chronic fatigue because of your adrenals, triple warmer, and cold hand, cold feet. That always dissolves when we do surgery. It sounds weird, but it is like it is. Yeah, it's really healing. You could open a clinic, only do this, and it would be like a healing clinic or something. You have to experience it yourself.
Is that the lower or the upper?
Which one? This is just the upper, but it's the same. And this one you can download, this one on our website. All articles, everything is for free. Just download it. Also, it's a YouTube channel. I'm trying to do it in English. This is a little bit too much. Check the autonomic nervous system. Something in here could make you be in fight and flight forever. And activate the HPA axis. I have to go over this pretty fast. I do later. So just this, the stress axis, which is actually ongoing every day. It could be the first email in the morning, could be your diet, could be stresses from your mouth, but basically you sense stress, whatever. Your hypothalamus and your pituitary communicate with your adrenals, produce cortisol. Basically, that's also when you're inflamed, you go to the doctor, you get a cream, apply something that is cortisone, and then the redness goes away. So you have that all day long. On the left, on the right side, you see your thyroid, which is always involved because the thyroid is kind of like a thermostat for all the stresses in your body. So cortisol will block. Basically, cortisol in itself, if it's too high, blocks everything. It blocks the pituitary in a secondary loop. With the LH goes down, it blocks TSH. So your thyroid will be slow, sluggish. So you have to see what is stress. And I want to emphasize this. There's so many stresses, but this one is 24/7 in your mouth. So this is something you maybe check the movie Root Cause, which you can find, because long term, you have all these problems of ongoing cortisol. You cannot sleep, you grind at night, you're super tense, you have a weak immune system, you waste muscle, you get stressed, you cannot sleep well, digest well. So if you're measuring stuff with the Oura Ring and you cannot go into deep sleep, of course, and you have a Faraday cage at night, everything. Maybe you have something in your mouth that still produces the same HPA ongoing stress on a daily basis. Sympathetic is there to help you fight and flight, basically run away from the saber-toothed tiger, produce as much energy as possible. It's great, but you don't have to activate this all day long. Maybe you need a little bit to do surgeries, maybe you need a little bit to concentrate, to produce energy, but you should be able to switch into yin mode instantly. And I've seen patients, they have not seen the opposite, which is this here, within 30 years. If you don't have any yin, like parasympathetic mode, you cannot detox, you cannot remove, you have a weak immune system, you're basically prone to all chronic disease. This is, and it could be starting in your mouth. So of course we have to focus on food, which is the food design, which is basically a lifestyle change, and it's go back in nature. There's a red chart and a green chart. You can download this, see it. The superfoods are categorized in macronutrients, protein, healthy fats, healthy carbohydrates, etc. And we're big on food intolerances, so the red chart, and there's always an alternative. You have to start this before seeing me, and you do that kind of like generalized, but when you see me, I will always individualize it after this. And you can download this booklet, and in the book, it's even longer, it's 40 pages. It's also focusing on neurotransmitters, chronic stress, all these things. So it's a systemic approach. And of course, we will test your vitamin D3 level because we know that bone healing is depending on vitamin D3. Looks like this is pretty basic. And the tuning involves having a goal of 70 nanogram per milliliter of vitamin D3 because we just want to have you boosted, because it's clear that vitamin D3 level drops and you need it to build bone, with also, of course, including K2, magnesium, all these cofactors. You will see a little slide. This is just my nerd brain developing all these things. So all these formulas I've developed over years, according to the patients I see in myself, all SNPs included, methylation problems, probiotics, prebiotics, everything is activated for cryptopyruria. So vitamin D3 receptor deficiencies or blocks are totally normal, because if you have heavy metals or infectious stuff, your receptors will be a little bit blocked. That's just basics.
I just want to jump in here quickly about the supplements. I'm talking about subs a lot at the moment, not because I love Dom, but when I went to Germany, it was like, stop everything you're doing supplement-wise and change to these, because I've developed them for me and my kids, and they're clean. Like every source of every single product is absolutely clean. Even the capsules are like absolutely awesome in terms of ingredients. And so first day for my surgery, they took a load of blood, they spun it to create some membrane so that when they took my wisdom teeth out, they could put the membrane in to help it heal quicker. But the first day before I'd been on the supplements, the membranes were like tiny, like 1 centimetre by 1 centimetre. And then a week later, they went back in to do some more work, and they did the same with my blood a week after being on the supplements, and specifically the amino stack, which is branched chain amino acid, essential amino acid, creatine and glutamine, and also the collagen. And the next week, the membranes grew to about this big. So it's showing that I was catabolic opposed to anabolic, and by adding in the right supplements at the right time, actually my body went into growth and healed very, very quickly. So I've tested this, which is why I wanted Dom here today, because it's stuff that I didn't even know, and I've been doing this for a long time. So it's really, really awesome stuff. We're working on maybe looking at bringing these to UK, because they're available in German at the moment. But I'm sure Dom can hook us up with a link or something if you want to try them. Anyway, I just thought I'd put in why specifically I think they're so good.
Thanks, man. Yeah, the focus was I wanted to have one that I used Thorn, for example, for the multi. I wanted to make one better one with my knowledge, which I needed. And the goal was having just a capsule, which is vegan, kind of like a prebiotic. I don't even have a lubricant, which all companies will tell you, we cannot produce your stuff because it will ruin our machines. We need at least a lubricant. Took me a while to figure out how it works. It works, but yeah. Just to make this product happen from the initial idea to have the capture at the end takes about 1.5 years to 2 years to finally have a product in your hand. If you wanted this, you can have this on the back within weeks, but the quality is the most important thing here. This is what I wanted to say. So that's the bone healing protocol. I'm big on protein because of being anabolic is the goal. Your body will, by removing all the sources, go into healing mode, meaning better detoxification, better regeneration, better removal, better everything. And you just need the basic supply. And in this case, I would go with at least 1.5 grams per kilogram for everybody, which is a little different for vegans. So that's why at least this one and this one is for vegan. Collagen for vegans is pretty difficult, yeah. Just calculate it. Looks like this. We can talk about this later. This is all the science involved. Basically, high doses of vitamin D3 is the micronutrient tuning. We do 20,000 IUs a day, which you cannot do just like this. You have to make sure to have all the cofactors, because otherwise you end up having calcium in your blood. But I want to have the calcium not in your blood, but I want it in the bone and in the teeth. So what I need for this is 2 enzymes that get activated by D3. It's kind of like the truck that will bring the bricks to bone and teeth. But you need somebody to drive the truck. This will be vitamin K2, and you need magnesium for this. You need zinc to activate the receptor. You need boron to double your length of vitamin D3. It's only 15 hours, the activated form. With boron, it's 30. So in the bone and teeth supplement, that's all included. And yeah, that's basically it. So this is the full-on concept. But we're starting with the lifestyle change, food design. We add in the micronutrients, but food first, macronutrient tuning first. It doesn't make sense to smash so many supplements if you just compensate for it. Just know exactly what you need. And I tested probably all of this the last 20 years, so I know. We remove metals under special precautions. We remove all root canals and replace it, if possible, with the natural alternative for patients that need it. Yeah, and my patient selection is probably a little bit extreme: chronic disease, high athletes, CEOs, etc. So they come for this. So I don't tell any patient what to do. I just present what I would do. You decide. I don't make any decisions for you. I don't convince. I have to convince. I will not accept you. So this is your goal, your challenge, your life. I can just help. Yeah, that's what it's all about. Again, it goes into it. And this part, remove the source, is a big one. If you have removed the source and you probably did all the other things, back to nature, lifestyle, diet, nutrition, blood work in check, supplements, then it will be a full circle and you heal yourself. That's my dad. That's the staff. That's the clinic. You can check it out there. You can download everything there. And
I just want to jump in. Can you go back to the last slide, Tom, quickly?
Yes. This one? Oh, sorry.
Yeah, so that's perfect.
This one.
So if you're a biohacker or optimizing your health, and any one of these things isn't right, you're not going to have the results. You're going to have chronic health issues or stuff going on. I think it's really important, even for me that's been optimizing for like 8 or 9 years. Like I had hidden cavitations that went under the radar. And until then, the body can't flourish. So obviously lifestyle is super important. We do a lot of these things. We have red lights, we try all these different supplements, we try all the different diets and everything. But if you've got metal in your mouth, or you've got a root canal, or any of these things, any one of these things are just super important to get ticked off. And you've got to minimize your risk by getting rid of all of them. I think this is one thing that really resonated me with Dom's work, because it's like we tackle all of this, including the biohacking aspect and the things that most people don't see. This is how it brings all together. So.
Thank you, Tim, that's basically the goal, to bring all the knowledge I've acquired over the years. For me, just my goal is to give it all back and help you also strive. I'm always looking for the next edge and tiny things. But I can tell you one thing. This is the basic stuff that will make your life nice, and the consistency. It's not like, okay, I'm testing this and then I test this. You have to have your basic covered, and then you might add in a little few things at the right timing. For example, I'm doing something right now. Also, I test this with blood work, and then I reassess and check. But I know that my lifestyle, my base is always the same. For me, it's a no-brainer. I have my protein always. I always have my D3 and my basics covered. But I'm kind of like the professor, and some of them are like first grade school, so it's difficult for me. I hope you understand what I'm saying, because I have to squeeze it in what I normally say in 2 days within 30, 40 minutes. Yeah, ceramic implants, you can check out Instagram. But basically that's it, right? And wait, that's the book. I told you already, I'm proud that it's coming out in English and in China and French. You can download it everywhere, pre-order it on Amazon and stuff, spread it. Use it for all your clients, because this is something that's missing. That's the goal. Bring it into functional medicine and melt it all together. Yeah, and help the mission that starts in your mouth, which is health. It's our focus, optimal health. All good?